my name is Shuji. I'm currently an assistant professor and health services researcher in Emory University School of Medicine, Department of Pediatrics. I'm also a faculty with the Aflac Cancer and Blood Disorder Center in Children's Healthcare of Atlanta. As I mentioned, I'm a health services researcher by training, and my research largely focuses on healthcare system and health policy issues pertaining to pediatric oncology care and cancer survivorship, with a particular focus on individuals with public health insurance, particularly Medicaid. That's partially motivates this current study. I'd like to answer this question by kind of sharing our motivation about this study first. So, continuous Medicaid coverage preceding cancer diagnosis is very critical for timely access to care, timely evaluation, which ensures early detection and diagnosis of cancer like lymphoma. And lymphoma is one of the most common cancers among pediatric adolescents and young adults, AYA for abbreviation. And among patients insured with Medicaid, it's important to note that it's very possible that individuals will not enrolled onto Medicaid until the point of diagnosis, which can be really concerning because, as I mentioned before, continuous Medicaid preceding diagnosis is a very critical period. So this really motivates our study. In particular, there had been a lack of data to clearly distinguish patterns of Medicaid enrollment in terms of newly gained Medicaid at the point of diagnosis versus continuous Medicaid throughout of the diagnosis and before diagnosis, as well as patterns of on and off Medicaid, like non-continuous Medicaid patterns. And fortunately, with the release of the SEER Medicaid linked database, we are able to use this multi-state population-based database to quantify these patterns. That's how we designed this study. So more specifically, we use the Medicaid enrollment information in the SEER Medicaid data to distinguish patients insured with Medicaid into three groups. One group is those with continuous Medicaid enrollment during the year before diagnosis through and at least 2 months after diagnosis. And another group is patients who did not have Medicaid coverage, very likely uninsured, but gained Medicaid at the month of diagnosis or within 2 months after diagnosis. And finally, our third group includes individuals who experience other non-continuous patterns of enrollment, and most likely those on and off Medicaid irregularly. So, and we linked information from these three groups to their stage of diagnosis of lymphoma. And we specifically looked at the likelihood of having stage 4 lymphoma diagnosis, which is the most severe type of diagnosis among patients with lymphoma. So first of all, we found that among our sample of Medicaid-insured pediatric and AYA patients with lymphoma, only 3 in 8, or in other words, 37.8 had continuous Medicaid coverage in the 12 months before their lymphoma diagnosis. And we also found that patients gaining Medicaid coverage only at the point of or shortly after their lymphoma diagnosis, or otherwise having non-continuous Medicaid coverage, were more likely to present with stage 4 lymphoma compared to those with continuous Medicaid coverage. And more specifically, the model adjusted percentage of patients with stage 4 lymphoma was about 26% for those classified as continuous Medicaid. And this increased to 31% for patients classified as having other Medicaid enrollment patterns and further increased to 40% for patients classified as newly gained Medicaid. And I think interestingly, we found that this strong linkage between continuity of Medicaid coverage and the likelihood of having stage 4 lymphoma is actually much stronger among adolescent and young adult AYA patients with lymphoma. But unfortunately, this AYA group is the least likely to have continuous Medicaid coverage compared to their younger peers. Our findings really highlight the importance of multi-level policies or interventions aimed to improve the continuity of Medicaid coverage for low-income patients with cancer.